Our lungs, the unsung heroes within our chests, function as our body's sophisticated natural air filters. They are undeniably vital for the fundamental act of breathing and are paramount to our overall health and well-being. However, like any crucial and relentlessly working body system, they are vulnerable and can be damaged by a host of factors encountered in our everyday lives, from environmental pollutants to lifestyle choices and infections. This inherent vulnerability is precisely why identifying the early stages of lung damage can make a profound and often life-altering difference in managing and effectively treating potential respiratory issues. Early intervention is key to mitigating long-term complications. In our comprehensive discussion today, we will meticulously delve into 13 critical early warning signs that your lungs might be under duress. Understanding these subtle yet significant signals is the first step towards proactive lung care. So I invite you to take a deep, conscious breath and let us embark on this important exploration together, examining what these indicators could signify for your precious health. Clubbing of the fingers. A curious clue. Clubbing of the fingers is a distinct physical sign characterized by the noticeable enlargement of the tips of the fingers and a discernible downward sloping or curving of the nails, sometimes described as resembling upside-down spoons. This intriguing phenomenon occurs due to specific changes in the soft tissue beneath the nail beds. It is frequently associated with long-term oxygen deprivation, hypoxemia, or chronic low oxygen levels circulating in the blood. Clubbing is commonly linked to a spectrum of serious lung diseases, including chronic obstructive pulmonary disease, COPD, lung cancer, cystic fibrosis, and pulmonary fibrosis. It's also important to note that clubbing can occasionally be an indicator of various cardiac diseases or gastrointestinal conditions. Therefore, the presence of finger clubbing is a significant clinical indicator that warrants a thorough medical evaluation to accurately determine the underlying health issue. Chronic cough, more than just a tickle. A chronic cough is medically defined as one that persists for 8 weeks or longer in adults, 4 weeks in children. This isn't your average cold-induced cough. It is a persistent guest that can be a significant warning sign of underlying lung damage or respiratory disorders. This type of cough can present as dry and hacking or productive, meaning it brings up mucus or phlegm. It is often more pronounced at night or early in the morning. A chronic cough may indicate the presence of conditions such as chronic bronchitis, a key component of COPD, asthma, gastroesophageal reflux disease, GERD, where stomach acid irritates the throat, postnasal drip, or, more gravely, lung cancer. Persistent, forceful coughing can also lead to other complications like headaches, dizziness, sleep disruption, urinary incontinence, and even rib fractures. Shortness of breath, dyspnea, gasping for air. Shortness of breath, medically termed dyspnea, is a highly common and often distressing symptom of lung damage. It's characterized by difficulty breathing, a feeling of not getting enough air, or a sensation of suffocation. Dyspnea can occur during physical activity, exertional dyspnea, while at rest, or it can awaken you suddenly during the night, a condition known as paroxysmal nocturnal dyspnea. This symptom can be associated with a wide array of lung diseases, including asthma, COPD, pneumonia, pulmonary embolism, interstitial lung disease like pulmonary fibrosis, and lung cancer. Shortness of breath is a critical indicator, especially when it occurs suddenly, unexpectedly, or severely, as it can signify a serious underlying health issue requiring immediate medical attention. Chronic mucus production, an overactive defense. Chronic mucus production involves the continuous or recurrent overproduction of phlegm or mucus by the airways, typically occurring daily for at least 3 consecutive months in a year, for 2 successive years, a hallmark of chronic bronchitis. While mucus production is a normal defense mechanism against irritants and infections, persistent and excessive mucus can indicate serious respiratory conditions. As mentioned, it's a classic sign of chronic bronchitis, a form of COPD. It may also be a sign of bronchiectasis, asthma, cystic fibrosis, or ongoing lung infections. Regularly coughing up clear, white, yellow, or greenish mucus can make breathing more difficult, obstruct airways, and increase the risk of further respiratory infections. Wheezing, the whistle in your airways. Wheezing is a high-pitched whistling sound made primarily while breathing out, exhaling, though it can sometimes occur during inhalation. It's often a clear sign of an obstruction or narrowing of the airways. Wheezing is a hallmark symptom of asthma, where airways become inflamed and constricted. However, it can also result from other conditions affecting the lungs, such as COPD, particularly emphysema and chronic bronchitis, acute bronchitis, allergies, respiratory infections like bronchiolitis in children, or even an inhaled foreign object obstructing the airways. In some cases, wheezing, particularly if new, can be caused by heart failure, cardiac asthma. This symptom should never be ignored, especially if it occurs frequently, is new, or is accompanied by other respiratory symptoms, as it often requires medical evaluation to determine the underlying cause and appropriate treatment. Blue lips or fingertips, cyanosis. A lack of oxygen. Blue lips or fingertips, a condition medically known as cyanosis, occur when there is insufficient oxygen in the blood or poor circulation. This discoloration reflects potential lung damage or severe respiratory disorders that impair the lung's ability to oxygenate blood effectively. This alarming sign is often seen in acute exacerbations of conditions like COPD, severe asthma attacks, pneumonia, pulmonary embolism, a blood clot in the lungs, or advanced interstitial lung diseases. Cyanosis can also result from congenital heart issues or heart failure, preventing adequate oxygenation and delivery of blood. The appearance of blue lips or fingertips is a critical symptom indicating that vital tissues are not receiving enough oxygen and requires immediate medical assessment and intervention. Coughing up blood, hemoptysis. An urgent alarm. Coughing up blood, medically termed hemoptysis, is always a serious symptom that can indicate significant lung damage or severe respiratory conditions. The presence of blood in sputum can range from small streaks mixed with mucus to expectorating large amounts of frank blood. The blood may originate from the lungs, bronchial tubes, or upper airway. Common causes include severe bronchitis, pneumonia, tuberculosis, bronchiectasis, and lung cancer. A pulmonary embolism can also cause hemoptysis. This symptom always requires immediate and thorough medical attention to determine the source and extent of bleeding and to address any potential life-threatening conditions. Chronic chest pain. A persistent discomfort. Chronic chest pain related to the lungs often manifests as a sharp, aching, or burning sensation that persists or recurs over time. The character of the pain can vary. It might be localized or diffuse. It can be exacerbated by deep breathing, pleuritic chest pain, coughing, sneezing, or physical activity. This type of pain may indicate various lung conditions such as pleurisy, inflammation of the lining of the lungs and chest, pneumonia, a lung abscess, or it can be a symptom of lung cancer, especially if a tumor invades the chest wall or pleura. Other potential causes include COPD and pulmonary embolism. Persistent or severe chest pain should always be evaluated by a healthcare provider. Frequent respiratory infections, a weakened defense. Experiencing frequent respiratory infections, such as recurrent bouts of bronchitis, pneumonia, or even prolonged influenza, can be a significant sign of compromised lung health. Individuals who suffer from recurrent respiratory infections may have underlying issues such as undiagnosed or poorly managed asthma, COPD, bronchiectasis, or an immune deficiency that makes them more susceptible to airborne pathogens. These repeated infections can lead to further lung damage, scar tissue formation, and exacerbate existing chronic respiratory conditions, creating a vicious cycle. Chest tightness. A constricting sensation. Chest tightness is often described as a constricting, heavy, or squeezing sensation in the chest. This uncomfortable feeling can be associated with lung damage or underlying respiratory conditions. It frequently occurs as a result of inflamed, irritated, or constricted airways, which can be triggered by chronic respiratory diseases such as asthma, a common descriptor during an attack, COPD, or pulmonary fibrosis. This symptom may be accompanied by shortness of breath, coughing, or wheezing, signaling a need for medical attention. It's crucial to note that chest tightness can also indicate cardiac problems like angina or a heart attack, so its cause must be determined. Unexplained. Weight loss, a systemic red flag. Unexplained weight loss, particularly when it is significant, e.g., more than 5% of body weight over 6 to 12 months, and rapid without changes in diet or exercise, can be a concerning indicator of various health issues, including serious lung disease. In the context of lung health, unintentional weight loss often accompanies advanced stages of chronic respiratory diseases like COPD or lung cancer. The increased energy expenditure from the heightened effort of breathing, coupled with decreased appetite due to breathlessness or medication side effects, and the systemic inflammatory effects of chronic illness can all contribute to this weight loss. Chronic fatigue, more than just tiredness. Chronic fatigue, in the context of lung health, is a persistent and debilitating sense of tiredness or exhaustion that does not improve significantly with rest. It can be a pervasive symptom of underlying lung damage or disease. It frequently accompanies chronic respiratory conditions such as COPD, asthma, pulmonary fibrosis, and sleep apnea. This profound fatigue may result from the body's increased metabolic effort to breathe, reduced oxygen supply to tissues and organs, chronic inflammation associated with lung diseases, poor sleep quality due to nighttime symptoms, or even the side effects of medications. 13. Swelling in extremities, peripheral edema. An indirect sign. Swelling in the extremities, particularly in the legs, feet, and ankles, known as peripheral edema, can be an indirect but important sign of lung damage, especially when associated with conditions like pulmonary hypertension or right-sided heart failure, cor pulmonale. Severe chronic lung disease can lead to increased pressure in the arteries of the lungs, pulmonary hypertension. This, in turn, forces the right side of the heart to work harder to pump blood through the lungs, eventually leading to right-sided heart failure and fluid accumulation in the body's tissues. Heed the warnings, protect your lungs. As we have discussed, recognizing these early warning signs of lung damage is absolutely vital for initiating timely intervention and preventing the further deterioration of your lung health. Symptoms such as a persistent chronic cough, unexplained shortness of breath, chronic mucus production, wheezing, or unexplained weight loss are not mere discomforts. They are crucial warnings from your body that warrant immediate attention and action. Individuals experiencing one or more of these symptoms must seek prompt medical evaluation to determine the underlying causes and receive appropriate, targeted treatment. Awareness, coupled with proactive healthcare management and lifestyle modifications, are the cornerstones of maintaining optimal pulmonary health and significantly enhancing your overall quality of life. Listen to your body, for your lungs are communicating with you.